Welcome, everybody. I'm Dr. Anthony Levinson with the iGeriCare live event. Today is February 9th, 2023, and this is our 36th live event. And the topic today, how personal support workers, or PSWs, can support dementia care. We're really fortunate today. Our guest is Miranda Ferrier, who's the CEO of both the Ontario Personal Support Workers and the Canadian Support Workers Associations. And Miranda's going to give us an up-close and personal overview of some of the specific ways in which personal support workers can assist you as a caregiver to someone living with dementia and improve the care for your loved ones. As usual, the structure of today's session, we're going to start with an overview. I'll have some questions for Miranda and cover some key topics. And then we'll have an opportunity for any questions that you might want to submit. If you're watching on YouTube, you can use the live chat, live discussion to submit your questions. If you're watching on the iGeriCare.ca events page, you can submit through the little chat bot on the screen. And without further ado, Miranda, thank you so much for joining us today.
Thank you so much for having me.
So maybe just to start, tell us a little bit about yourself and your professional experiences and roles.
Sure, great. Well, I am a personal support worker. I am a graduate of the Mohawk McMaster PSW program of 2006. I've worked in long-term care, home care, and hospital settings as a personal support worker before I founded the Ontario PSW Association way back in 2010. I saw a need for my colleagues in the field, and now we represent over 70,000 frontline support workers across Canada. So exciting.
That's great. So, it's sometimes confusing for people. There are different names for personal support workers across the country and in different provinces and different institutions. Can you give us a little bit of the play-by-play in terms of the different terms that are sometimes used?
Sure, absolutely. This is something that we deal with on a daily basis at the associations. Obviously, here in Ontario, we are referred to as personal support workers, or PSWs, although some Ontarians also might have heard the phrases home support worker, healthcare aide, resident care attendant, supportive care worker, and the list unfortunately goes on. But those are not actually personal support workers. PSWs have a very specific training that they do and that they attend here in Ontario. In New Brunswick, we are referred to as PSWs as well, but then you go into like Newfoundland and Labrador and we're called personal care attendants. Nova Scotia is continuing care assistant. Manitoba is healthcare aide.
Wow.
You know what, we're called something different. There's over 100 titles across Canada for the support worker. But we are just going to refer to it as PSW today, I hope,
Yes.
just to make it clear, but there's over 100 titles. Yeah.
So tell us, the overview of what the main jobs or roles, or a description of what PSWs do.
Sure. Well, a personal support worker assists those with their activities of daily living, or ADLs, as many caregivers will hear health professionals refer to them as. So that's anything that you do for yourself in a day. So that's getting up out of bed, that's brushing your teeth, brushing your hair, toileting, showering, bathing, dressing yourself, food prep, eating, mobility. I like to say that the PSW is an extension of those in their care. So they also take care of the entire being. So also socialization, mental health. The PSW is everything to the people that they care for.
And I guess one of the challenges with these different names, and you mentioned that not everybody with some of these occupational names is necessarily a PSW. So, how can you know if, somebody coming into your home and helping to care for your loved one, or, a person in a hospital that is referred to as a healthcare aide, how can you get a sense of whether they are a PSW or not?
So that's a real tricky question, right? Because we're very largely unregulated. So the PSW across Canada is an unregulated profession. Although I am happy to share with everyone watching that as of June of almost 2 years ago, the Bill 283 here in Ontario for the Healthcare Authority under the Ministry of Health is developed now and is going to be regulating PSWs in the province of Ontario. Hopefully, they state by December 2023. So here in Ontario, it's going to be a little bit different and we'll be able to differentiate. We always recommend to members of the public and caregivers that if you're unsure if someone is a personal support worker, we ask them to ask if they're a member of our professional association or their association. Reason for that is that in order to be a member of your professional association, and this goes for nurses and doctors as well, you have to have, credentials. Valid credentials. You need to have a clear criminal record check. You need to hold, professional liability insurance. So we always recommend that. But if you're still unsure, I would ask to see proof of their certification and reach out to their place of schooling or the association if you have questions or concerns.
So just for my better understanding and the audience, when you talk about unregulated versus regulated, explain the landscape, I guess, currently and what will still be the case. If somebody belongs to an unregulated profession, what does that mean in terms of their credentials and some of those other things that you mentioned?
Okay, so I'll use the nurses and the doctors as an example because they're a great example in the healthcare landscape. They have to meet a certain criteria, certain level of education. They also have to, adhere to a scope of practice, a set scope of practice, standards of practice. So that's a scope is what you can and cannot do, and standards break it down into different things as to what you can and cannot do. And they all follow a code of conduct, code of ethics, whatever you want to refer to it as. Personal support workers are largely unregulated because we do answer to and we fall underneath the nurses and the doctors. So for a very long time, it was looked at that, PSWs could be delegated to. What that means is that someone who is a registered health professional can delegate a task, teach a task, show a task. Anything from catheterization to wound care to medication administration, injections. If they feel that PSW is able to perform that task, they can show them how to do it, and that PSW will be able to do it for that one patient. It's not a broad delegation, it's a very narrow delegation. However, now what we're seeing is because of the lack of PSWs, there's not a lot. We don't have a lot, especially after COVID. Nurses, we don't have a lot of nurses. The scope of the PSW is expanding. The need for the PSW is expanding. Probably about 20, 30 years ago, nurses were known for doing bedside care. They were the primary bedside care nurse. That's who you would get at your bedside in the hospital in long-term care. That's not the case anymore. The person who is performing the majority of bedside care across Canada is the personal support worker. So with that being said, there's more of us than there are nurses or doctors. So we need to have a strict regime to follow. So we not only protect the public, but also protect the personal support worker from being taken advantage of by employers, etc. So I hope that laid it out a little easier to understand.
Yeah, we might circle back to that. I think when we maybe talk a little bit about the type of training I think that PSWs get. But I guess maybe we have a little bit of a sense of some of the activities and duties that a PSW may perform. Can you talk specifically about some of the activities specifically for assisting, dementia care partners or in the care of people living with dementia?
Sure. This actually is something I did when I worked as a personal support worker. And I was one of my most enjoyable jobs was to work in long-term care with those with dementia. We personal support workers, I like to say, are a wealth of knowledge for caregivers that care for their loved ones with dementia 24/7, especially to those that still have their loved ones at home. And have home care because the PSW is just full of ideas. And I always say to caregivers, lean on your PSW, get them to share their ideas and their knowledge surrounding memory care, just anything and everything related to it. Why? Because many PSWs actually come into the PSW profession strictly to commit their entire careers to those working with dementia. So the PSWs are very good at memory care boards, memory care ideas. They're very versed on different types of dementias. And that was something that is quite, unfortunately, a common thing that we hear at the association is, well, my mom doesn't have dementia, she has Alzheimer's. So and we always say too that if you feel that your PSW doesn't have enough of the training, invite them to take training. There's lots of training like you guys offer that the PSW can access just online. But a PSW can assist those with they can assist the caregiver with some respite. So if the caregiver needs to have some time to themselves, maybe go grocery shopping, maybe go to the spa, a PSW can stay with their loved one and care for them while the caregiver goes out. They can also assist with, let's say, unfortunately, many times we see aggressive dementias, an increase in aggressive, and the PSW also has that training that they can assist the caregiver with parts of a plan. We call it the plan of care or care plan that you can develop with your PSW and the team, either through a home care agency or just with the PSW. Some of them work alone directly for families that can bring everyone together and have a set plan for your loved one, so you know how to deal with anything in any case that arises. So the PSW can help with meal preparation. They can do a little bit of laundry. They can take the weight off the caregiver, which we all know that caregiver burnout is a real thing.
And I said we might come back to the issue of training, but I guess I'll just ask, in the training of a PSW, will they typically get special training in caring for people with dementia?
Some cases, yes. So I'm going to break it down as quick as I can. It's like Pandora's box when you're talking about the PSW. This is why regulation is so important. There's currently 3 different curriculums in the province of Ontario for the PSW. I'll use Ontario as an example. We have the community colleges, which is like Mohawk College. We have the career colleges, which is like a medics or a trios college. And then we have the Board of Educations, which is like Catholic school boards. Continuing education centers. Okay. And so in some of the schooling, I know through the community colleges, they do have like gentle persuasive approach training that all of their PSW students take. In the career colleges, some do it, some don't. And in the Board of Education, I'm actually quite unfamiliar, to be honest with you on it. Some do, some don't. So we always say that, the PSW program is the novice. Once you graduate from that program, that's why, as an association, we offer all these different continuing education opportunities, because PSWs many times, especially those that have that kind of that love for working with those with dementia, will take those extra courses and expand their portfolios.
So a bit of variability in the curriculum, and because it's not necessarily regulated, there's no sort of strictly speaking requirement that everyone must be trained, but maybe, as you said, still a lot of people who train as PSWs would work with people with dementia. So there's some experiential learning and opportunities for continuing professional development in the area.
We do get about a week training in the PSW curriculum. Okay. There is a week, but I'm talking above and beyond that, which is something important to have. Some of it is GPA, and then others, it's up to them to find their own training. But a lot of them do. It's a very popular field.
Mm-hmm. And GPA, just for the audience, that's the gentle persuasive approaches, which is again, one of the best known approaches for helping to manage responsive behaviors. So, we talked a little bit, and you gave some great examples of some of the ways in which things that PSWs can do. Maybe tell us a little bit about what they can't do. I guess this is back to sort of scope of practice. And I think sometimes you will hear I will hear from patients' families, and they'll say, what I really want is somebody to, go out and do the shopping, or I can't carry, the groceries into the house. And you mentioned laundry, but I don't think PSWs will always do laundry. It may depend a little bit on, the situation or organization. So maybe just tell us a little bit more about some of the things that generally PSWs do not do, or is outside of the scope of most.
Absolutely. And it's confusing again. So I apologize if I have to go back and say it again. But it's so PSW, especially in a home care setting. So I'll talk on the home care setting. A personal support worker, again, assists those with their activities of daily living. So anything you do for yourself, mobility, eating, meal preparation, etc., they can do that. Going shopping for groceries is actually not common. The PSW typically will not do grocery shopping. The reason for that is that we kind of play that role in between non-medical and medical care. We kind of play that nice little kind of gray area. And when we are visiting with a client, especially if we are a company PSW, so I'm talking like a PSW through Ontario Health, we have a very regimented time that we are able to be at your home in order to help you with what needs to be done from the care plan. So we follow the care plan. Now, there are some private companies that do supply PSWs that go out and do the grocery shopping. So you also have that option, but that's private care and that's out of your own pocket, or it could be copay, but primarily it's out of your own pocket for that. The PSW can do light housekeeping. And what I mean by light housekeeping is changing the sheets on your bed once a week, throwing laundry into the washer, putting it into the dryer, putting it away if they're there that long that they're able to do that. They can wash your lunch dishes. If they prepared you lunch, they can wash your dishes or put them in the dishwasher. They can tidy up. But what a PSW cannot do is change a light bulb. We're not allowed to stand on ladders. We can't wash your windows. Everything I'm saying, by the way, has been asked of us. We can't scrub your floors. We can't even move your dining room chairs to vacuum. So it's a very kind of minimal light housekeeping that a PSW can do. We can clean your bathroom though. So we can give your bathroom a nice little wipe down.
Are there some things that are at the discretion of the particular worker as well, or do these tend to be sort of standardized types of things? Like I guess I'm wondering about, I've heard people say, oh, I wanted, the person to do light housekeeping or something like that, but they didn't feel comfortable, or maybe it was more a question of time and they didn't have enough time. Or
that's kind of when you get into that, is there a care plan? So a care plan is something that's put in place between the family or the loved one and the company that the PSW works for, or with Ontario Healthcare coordinators, or with just the personal support worker. And especially if you're working for Ontario Health, like through the Ontario government for the free care, you cannot go off on a different direction from that care plan.
So the care plan is a bit of a contract in some way. I mean,
maybe
that's too formal, but it's basically an upfront agreement, especially if you have, health professionals that are, like a formal home care, or a company that says, this is kind of the care plan. This is what this person will do. This is what this person won't do. Is that kind of the idea of the care plan?
Kind of like a nurse. It's primarily a nurse. Actually, we're seeing more PSWs in this role, in the care coordinator role. They will either call you or come out to your house, and they will sit down with you and they will discuss, many times it's the children of a parent, and they'll say, what does mom and dad need? Does mom needs a shower 3 times a week. Okay. Mom needs help with reminders for her medication. Okay. Mom needs meal prep. Mom needs her laundry. Can you throw the laundry in once a week for us? Mom needs her bed stripped. Okay. It's very, very specific as to what they do and what they don't. But that's Ontario Health. Now, if you go into the private sector, which is many people are familiar with these names: Home Instead, Right at Home Canada, Comfort Keepers. These are franchise home care companies.
Okay.
Some of them are copay, and some of them are full pay. So the family would have to pay for the care themselves directly from pocket. Those ones have way more wiggle room in response to what a PSW can and cannot do, because home care is kind of the wild, wild west. There is no real hardcore legislation surrounding home care. going to change, but right now it's kind of the wild, wild west. So with private care, you can get a lot more depending upon the company, but with Ontario Health, it's very regimented. So
in terms of like across the country,
yeah.
based on your knowledge and experience, is it pretty similar in other provinces where they'll have like some, standardized provincial version of home care supports, and there's also these private companies that are available for hire? Are the either, depending on if you have some kind of private insurance, it might help to pay for some of it, but you might be paying out of pocket, but you might have more options in your care plan potentially.
Well, I mean, and it is, and every province is very different, and in provinces to territories as well are extremely different. There's health authorities across Canada in different provinces. Like Nova Scotia has a health authority, Newfoundland has a health authority, Alberta, British Columbia. We don't really have a health authority here in Ontario, so we operate slightly different than other provinces in that regard. But it's basically the same kind of idea. Right. A lot of PSWs or healthcare aides, they work for the health authorities, in their provinces, and they have PSWs that work in home care, PSWs that work in long-term care, PSWs that work in retirement, PSWs that work in assisted living, PSWs that work in hospitals, all under that authority, right? We don't have that here. So that's why it's a bit more difficult for me to explain certain levels from Ontario.
But it does sound like by and large,
Basically.
most provinces and territories are going to have some kind of government provision of home care services that might include PSWs as a major portion of that care. But Absolutely. Then they will also be these franchises, where there might be care available for hire if you can afford it. And I think what you've also highlighted is that PSWs, or their equivalent based on the name, they could be working in a wide range of different environments. So coming to the home, working in hospital environments, working in assisted living, retirement home, and long-term care homes. So, one of the things that comes up in my practice are, concerns that caregivers have about, trust, communication, as you've described it. These are very intimate, personal care things: bathing, feeding. Oftentimes the person's in your home. So I'm wondering if you could talk a little bit about the challenges sometimes that caregivers and people living with dementia might have in accepting PSWs into their home. And then I guess the converse side sometimes is, I often hear stories of disappointment. They come to get used to one particular PSW and develop a relationship, but then that person, can't come regularly. So they have like a favorite, but then somebody else is coming. And again, because these are very intimate care things, that's sometimes a challenge. And then, sometimes the person's scheduled to come in the morning to get the person ready, but they don't show up on time. And, maybe just talk a little bit about day-to-day issues that can sometimes affect that relationship between a caregiver and the PSW.
Yeah, and my heart goes out to the caregivers that deal with this, and in particular right now in Ontario, this is a massive, massive issue that we address daily at the association. And we hear from caregivers ourselves who call and say, my PSW hasn't shown up. But I mean, in response to like working with those with dementia specifically, I think in a dream world, I think where we all want to wind up is where there's continuity of care. Where there is that same personal support worker day in, day out that comes into your home. And we all, people can say, why? Well, I mean, if someone has dementia, you need to be there constantly in order to know how to deal with their behaviors and how to keep things consistent. As soon as we throw a wrench into any schedule in that situation, it's like rewinding the tape and having to start from the beginning again, which it can be extremely frustrating, not just to the caregiver, but also to the patient with dementia. So I can completely empathize with the caregivers on that front and beg them for their patience at this time. The reason there's not enough personal support workers in the province of Ontario, or frankly across Canada right now, in order to provide everyone with the with home care, unfortunately. And and having trust and people being in your home, I get that. I completely understand that. I did care for a gentleman with, I called him Pa, with dementia. Him, Ma and Pa were their names. And I was in there for 4 hours in the morning, 4 hours in the afternoon. And I did everything for Pa, but I also did a lot for Ma. And, I was fortunate enough that I did 40 hours a week at that home, and I was a consistent PSW for them. But before me, they didn't have that consistency. And Pa had major behavioral issues. And like, he was very aggressive, extremely aggressive. But because I was there consistently, everything calmed down in the household. So I can definitely relate and understand caregivers' frustration surrounding that. I think sometimes what I find works is caregivers actually have like a bullet point list of what works with their loved one and what doesn't work with their loved one. I've heard that from some PSWs that works really well, because not just are the caregiver kind of out of their comfort zone, same with the dementia patient, but so is the PSW.
Yeah.
I mean, I can't tell you how many times we get told, you're going to go see a 75-year-old male who has Parkinson's, and you show up and it's an 83-year-old female with vascular dementia. Right. So you're not getting the correct information either, because you're not in the office. Remember, PSWs are on the road. Right. So
that's a really good point. I guess if you had a couple of tips or advice for care partners, family, friends, and we've highlighted in previously too, the Alzheimer's Society has a really good sort of, you can do a one pager or a multi-page sort of all about me, which like kind of gives a capsule summary of what the person likes and dislikes. I mean, what you describe is even more specific in terms of, tips for a PSW or somebody providing care, like what things, work well and what things the person doesn't like. But is that the kind of thing, like what would help to, ease that transition? Or if a new PSW is coming on the scene, is it this kind of like a one pager or a conversation with the PSW? What would you recommend? Yeah,
I would recommend both. I would, because and really simple stuff, and humanize the patient. Like, that's what I always say, is humanize them, because many times, and it's no fault of any health professionals, but we go one, we're one after the other, and we got to get in there. Okay, we got to do a bath. Okay, we got to feed. Okay, we got to do this. We got to do that. And sometimes we need to slow down just a little bit, just not so much, because if there's PSWs watching, they're telling me, yeah, good luck, Miranda, can't slow down. But sometimes we got to slow down just a little bit and say, this is Jack. Jack has dementia. Jack doesn't like it if you stand behind him. Jack doesn't like it if you stand to his left. Simple instructions like that can actually help a shift, especially if it's a PSW that's either filling in for your regular PSW or it's just a new PSW. It will really help us dive in faster with more knowledge and confidence in taking care of your loved one, knowing that we're not going to do something wrong. Because that's a big kind of nerve-wracking experience for us as PSWs too, because we're coming into your home. We don't know who you are either. So it's a give and take situation. And I find caregivers breathe a little easier once the PSW has that information, and they don't have to struggle with, I hope they don't stand behind Jack. I hope Jack doesn't hit them or whatever. And they can have confidence knowing that at least they provided that information to the PSW.
Well, that's a great overview of a wide range of issues. I guess we talked about the complexities of all the different names that, but I think you gave us a really good overview of what most PSWs can and cannot do, the importance of a care plan, irrespective of where you are meeting your PSW. I suppose if you're in a institutional setting, like you're in a hospital or you're living in a long-term care home, then I suppose the employer has really kind of dictated what it is that the PSW will or won't do. But you as the family member can still provide advice to that person to say, hey, you're new, you haven't met my spouse. These are the kinds of things that tend to work well with him. And
One pagers can go a long way, even in long-term care. I worked on a lockdown unit in long-term care for people with dementia, and my favorite was this one Dutch couple. I'm Dutch, so it worked out really well. But she had a one pager at the head of his bed that explained what he liked, what he didn't like, and it made the whole process so much more smooth. Because I don't think, and I don't know if all caregivers understand, many times PSWs, even in long-term care facilities, we don't have time to read your loved one's care plan. So even the new ones, even the new PSWs get thrown on the floor, and, we got residents we got to take care of. And so having that little bit of teamwork with the families and the PSWs goes a really long way for better care for the loved ones.
Oh, that's great. Well, let's move to taking a few questions that have come in. And here, one of the questions is, it seems like PSWs work in different realms, and there might be different ways that you come across them or find them. Obviously, if they're employed by a long-term care home or a nursing home or a hospital, that's different. But if you are looking for a PSW for care in the home, what would be the best approach? Like, if you're a care partner and you're looking for a credentialed PSW, how would you go about that?
So we always recommend going to Ontario Health first. So I should explain that Ontario Health is the new LHINs, so the local health integration networks that everybody knows in the province, and going to them and finding out if you're eligible for free care. That is the first step.
And this would be, I guess, we might not know what every province has, but I'm going to say that many of the provinces have a provincial health, similar approach. It might have a different name. It might be the health authority. It might be the provincial health, but in many cases, there's going to be some kind of provincial plan for home care services.
Absolutely. And we always recommend going through your general practitioner, your GP. That seems to be the easiest route to having them make a referral. Or you can call directly, which in every province is different. And you just look in the area that you live. So if you live in Southwestern Ontario, you look at the Southwest Ontario Health Teams, and there's a whole website that you can find online. It's quite easy to find it online, to be honest. But also too, is you can also call the Home and Community Care Support Services by calling 310-2222.
So again, that's for our Ontario audience.
That's Ontario audience only. Yeah.
But I think your advice is a good one in terms of, primary care provider would be a good point of contact for somebody to find out what services. And in some cases, they might actually need a referral from a physician or a nurse practitioner in order to, get access to a consultation with home care to find out their needs. So that's a good first point. And then I would think that there are similar contact points. The other resource I often mention to people is 211, which is available in many provinces and territories across Canada. You can dial 211 to find out about community and social services with a trained kind of operator. Usually they can service in many languages as well. And 211 typically has websites in provinces like 211ontario.ca. So that would be another source. What about by reputation? Like, if you are really looking for to find out that somebody provides quality care, are there other approaches for some of these private organizations, or do you try to find word of mouth? What do you recommend for people if you're looking for a PSW who is of high quality, I guess.
High quality. Okay. Well, here in Ontario, I can speak across Canada. They're welcome to reach out to our Canadian Support Workers Association. We do work with companies that are accredited partners that have to meet certain criteria in order for us to support them. And also our entrepreneurial PSWs. Here in Ontario, they can actually go to our website, which is opswa.ca, and click on PSWs by region. I had to write it down.
Okay.
And we actually have maps of all of Ontario, and they can click on the location where they live. And what will pop up is all of our accredited home care partners and all of our entrepreneurial PSWs that have their own PSW companies, or they work strictly just themselves for families directly. All of them carry professional liability insurance. They all follow code of ethics. They all have the education needed.
Okay.
So at least you know you're getting what you want in that aspect. We also recommend too, if you don't want to go that route, you can always Google in your area for home care companies. And we know that the local health integration network websites are still active. They have even across the authorities as well. We'll have like the health authorities in different provinces. We'll have a list of home care companies or agencies that they deal with strictly as well.
Okay.
So, I mean, you can also Google to find out that information. But if you're looking for more personal, then I would recommend obviously our association.
Okay.
Yeah.
That's great. And we can add some of those resources to the iGeriCare resource area of the site as well. One of the questions that just came in is, do you have a template for a care plan or some kind of like one pager with a personal support plan that either your association produces or that you'd recommend?
We do actually. So if they actually want to see a template of our care plan that we do actually give to our entrepreneurial members, they're welcome to reach out to us, email us, and we're happy to share it with them. So,
okay.
yeah.
And maybe we can figure out how to either post that or link that. We often send a follow up to our registrants and members just to let them know when the recording of our live events are available. So we can maybe share that at that time as well. So that's great. We had another question come in with respect to the assisted living environment, and I'm wondering if you can kind of define assisted living and tell us a bit more about the role of PSWs. There was a very a bit more of a specific angle on this. The person who sent in the question was a health coach or a educator for people living with diabetes and who had memory problems. And I guess she was concerned, or they were concerned about this particular group of people with diabetes and memory issues living in assisted living, and I think felt they might need more help. So I was wondering if you could comment a little bit about the role of PSWs in assisted living and maybe some clarification around what assisted living encompasses exactly.
So I'm going to, okay. So you have, again, it's another explanation. You have assisted living and retirement homes. Those are one and the same. Okay. And then you have long-term care homes. So long-term care homes are the ones where it looks like hospital rooms for the most part. That's where 24/7 care occurs. Nurses, PSWs 24/7. Assisted living and retirement homes fall underneath a completely different ministry and a completely different act. So they fall underneath the Landlord and Tenant Act. Okay. So employers, so retirement home employers don't have to, or assisted living, don't have to hire personal support workers.
They can I think it's fair to say there are differences across the country, again, in nomenclature too, but in, to your comment before about the Wild West, like the term retirement home and the term assisted living, if you went to 10 places that called themselves that, you'd find 10 different things, right? Like there's really, as you said, like long-term care homes and nursing homes, historically, even though they differ a bit by province, they tend to be, more regulated, accredited, a clearer level of like structure and oversight, as much as the pandemic has also shone a light on the many different arrangements, standards, quality issues in those environments. They are probably still structurally more similar to one another across the country, whereas assisted living and retirement homes, it kind of runs the gamut from actually like not a lot of services, a sort of free-for-all like apartment building kind of style, as you say, landlord tenant,
to
like very swank kind of almost like resort type living environment, like, and it seems like it's a huge difference. And I know we're working on a project now looking at unmet primary care and mental health needs in retirement home settings. And in many cases, I'm not sure whether it sort of aligns with what this person's question is about assisted living, but certainly many retirement home settings, at least in the province of Ontario, are probably underserviced in terms of medical care and mental health care.
Hugely so. Some retirement homes are, like you said, fantastic, amazing. They only hire personal support workers, but other retirement homes they don't hire. They have one PSW. And the difference too is that, so PSWs we're not technically allowed to administer medications. We're not trained to do that when we're in school. But in retirement homes and assisted living, PSWs do administer medications in these places. And that's up to the PSW if that's what they want to do, and that's fine. They can do it. But it's very risky. It's extremely risky. They can hire anyone off the street and give them a 5-minute video on, medical or medication administration, and suddenly they can, give out meds. Now, needless to say, the Retirement Home Regulatory Authority here in Ontario is working very hard to try to regulate the profession, not the profession, but the retirement homes and assisted living more so that the safety of the residents that live there come first. But it's, it's people get confused all the time between long-term care and retirement. Retirement, you're supposed to still be independent.
Yeah.
Right.
And the assisted living is you're
the same.
Independent, but you basically might have a bit of assistance. And for sure, I mean, I think in some settings, like the building may hire a PSW or a rehab professional for the entire building. So obviously, if your needs are higher and there's 40, 50 other people in the building who may also be expecting assistance, then you're not going to get a lot of individualized care.
No, we've heard stories of PSWs that worked the overnight shift in retirement homes, and they're one PSW to 90 residents. Because they're supposed to be independent. You shouldn't need a huge level of care if you live in retirement. Yeah. Unfortunately, across our nation, there's not enough long-term care beds. So a lot of people have wound up, unfortunately, in retirement homes or assisted living with long-term care level care. And the PSWs, or the UCPs, unregulated care providers is what they call them, they don't have the necessary equipment or the means in order to care for these individuals properly in retirement or assisted.
Yeah, and it's obviously an enormous challenge, I think, for the people living and continuing trying to live independently, and families who are continuing to try to make it work even if the person's care needs are higher. I wanted to sort of finish off with it's a statement that was sent in from a caregiver, but I think it's really beautifully phrased. So it says, the shortage of PSWs in long-term care homes has resulted in transactional relationships between PSWs and residents. My mother's 91, has Alzheimer's, has been in a long-term care home for 5 years. We're there almost every day. In these challenging times, family members play an important role in filling the gaps and need to step it up. The role and importance of PSWs to people like my mother is so valuable, and we're lucky she's in a great home with great staff. Thank you. I think it's really well said. I think the role of PSWs, we've been talking a lot about, in the home, which is a very important aspect. But PSWs are also really the front lines in long-term care homes, and what you've described with the pandemic, with the shortages, many of the staff doing their best in these very challenging circumstances, and families filling such an important role in these other care settings, like whether it's the hospital or long-term care homes. Maybe in 10 years ago, 20 years ago, if you were in a hospital or a long-term care home, there was adequate staffing that family could have a bit of a break. Now I think families remain kind of the linchpin of helping to provide care to their loved one, even when that loved one is in these settings. But for sure, both personally and professionally, my experience is the contact point for consistent high quality PSWs in long-term care homes is that is the person's experience. And what you're saying now, even in addition to nursing on the front lines in hospitals, many people are having their day-to-day care from PSWs.
Yeah, we're the up and comer. We're definitely the up and comer, but I really appreciate her statement about PSWs and they care. And I really want to convey that to the caregivers is they really do care, the PSWs, and they've been put in an impossible place. Just like
I think that's I think that term, like the transactional aspect of it, is just the is really, really hard to kind of try to do it all when you're pulled in so many directions, and you're just you don't have as much time to continue to build those relationships, and you're moving from one task to the other. So
build them. They want it real bad. We hear it all the time. They love their residents and clients and patients. They just don't have the time, and so they carry that.
Just one final question before we wrap up. Does your organization provide any information on PSW service costs? Like any kind of overview around that? So would people be able to find that information on your website?
Best thing would be actually to contact us directly. And we actually have PSWs in our team that reach out directly to these families and answer their questions.
So would that be by telephone, or what would be the best?
We recommend
email?
We email or visiting our website. We've contact forms all over our website.
And just what's the URL for the website? We'll put it into our resources as well.
Sure, it's www.opswa.ca for Ontario, but for Canada, it's www.canswa.ca. So we're happy to help.
Great. We will add that to our follow-up. So I want to thank Miranda Ferrier so much for joining us today for this very illustrative overview of PSWs and the current landscape, helping to care for people with dementia. Our next scheduled live event will be April 20th at 1 p.m. Eastern. There is a feedback survey that is pinned at the top of the comment section. If you were watching on YouTube, please give us some feedback and let us know what topics you'd like to see in the future. We'd love to acknowledge all of the contributors to our iGeriCare.ca initiative and live events powered by the Canadian Centre for Aging and Brain Health Innovation, which is powered by Baycrest, the Geris Centre at Hamilton Health Sciences, McMaster University, the Hamilton Health Sciences Foundation, the Alzheimer's Society Foundation of Hamilton Halton, and our team at the Division of E-Learning Innovation. We hope that you continue to enjoy iGeriCare and our live events and lessons. Please contribute through considering a donation to the site. In the top right corner of our iGeriCare.ca website is the donate button. 100% of your donation goes to supporting live events and e-learning through the site. One final thing, as always, don't forget, teamwork makes the dream work. So I want to thank our whole team today, in addition to Miranda. Take care, everybody.